as you know, I grew up in Tibet and then studied Tibetan medicine and Buddhism, and then moved to Italy. My half life is in Tibet, half life is in Europe. And what I do is mostly teaching Tibetan medicine, and also try to see Buddhism, how the Buddhism used as psychotherapy.
But what I mainly do is really treat people with mental illness, in my case severe mental illness, people with psychotic vulnerabilities. I prefer to use the word vulnerability, and I think that's something that in Sowa Rigpa you see more, that you take the whole person into account. And I think in modern Western medicine, it comes from a very mechanistic view, like the human body as a machine, and that works very well for the heart, for the lungs. When you have this view on the body, it's very efficient. You can really treat people for a lot of conditions, and it has made a lot of progress. But then what we see now is that we have been able to solve most of the acute problems, but now we see the underlying chronic problems that is more challenging. And in psychiatry, definitely it's chronic conditions, it's to have a psychotic vulnerability. It means you are more vulnerable to get psychotic breakdowns. Doesn't mean you're always in psychosis. It can happen that you are psychosis free for a whole long time, but you are more at risk to get psychotic breakdowns when you are triggered by stress, by drugs. So those are the two main problems, and I think.
So you're saying problems, stress and drug.
For psychosis.
For psychosis.
Yes, for psychosis, stress can be any stress, For people who are vulnerable to stress, they have a vulnerability to stress, so and we can't live a stress-free life.
So exactly. If the stress is very high, that's almost equal to like a drug.
Yes.
It
can really trigger, and of course we cannot be in a stress-free world. Stresses are part of life, but then that's also why we have a more holistic view when we work with people with psychosis, is to, for example, find a safe place to live that will reduce the stress. If you're homeless, you're more stressed than if you're not. Find a place to work or to do an activity, volunteering or learning a new language or whatever, because then there is predictability, and predictability reduces the stress too. So we do all those things, and so we are kind of
give them a motivation that to help them to see they can do something,
and to have a predictable things that are recurring. Regularity helps reduce the stress, and so I think we really want to help people achieve that. And I think the ideas of Sowa Rigpa in Buddhism, they're really about looking at a person as a condition, with all his causes and conditions. Where the medical approach, at least how I was taught, I'm not saying it's a bad thing, it's very useful, but it's more, psychosis, and that's the treatment. But not looking at, I was not taught at looking at the person behind it. Of course, I learned by experience, but it's not part of what they teach you in medical school. The theoretical class is about illness and the treatments for illness, but we don't look as much as, we do look at epidemiology. Certain immigrants are more at risk than non-immigrants. We look at all those things, but in Sowa Rigpa there is this whole idea of typology, and looking at the person. We start from the person, we don't start from the illness. That's what I'm trying to say.
Exactly. Now we are here in the Pure Land from the garden, so when you are talking these things, I was imagining like we are in the garden.
Yes.
So maybe Sowa Rigpa is talking whole garden, there are flowers and plant and bushes and treated, untreated, and there are many like weeds around too in this garden. It's not like a perfectly controlled garden. It's a kind of little bit like chaotic, but all kind of organic.
Yes.
So I was just imagining that when you said like very mechanical, you know, the plants are in order, everything is, flowers are trimmed, like everything in order. So something like that. Sowa Rigpa's wholeness is coming all together.
Yes.
You know, the soil, the plant, the flowers, and including the weeds.
Yes.
You know,
Yes.
we should
Including
accept,
the weeds.
and we should accept the weeds also. There's a reason there's a weed. So more talking about like the garden's health or balance, like all
Yes.
putting together.
Yes.
And I think the one your one is maybe like targeting like one very specific disease, saying, oh, we have to eliminate all weeds,
Yes.
and we remove them, and then grows more, and then this and
Yes.
that. Not
Yes.
like in a holistic way seeing it.
Yes.
No?
Yes, like you could say, I don't know if it's the English or the French gardens, which are super organized,
Normally,
where you
yes,
are
yes,
continuously making the hay
Exactly.
to look perfectly nice and having those nice shapes. That it's a lot of work
yeah, yeah,
to keep it perfect all the time, and
Yeah.
it has to be perfect, and there is no freedom in that garden.
exactly.
Whereas Sowa Rigpa is more, yes,
Yeah.
and
Like our garden here.
Exactly. For me, who works in psychosis, where people are very different and they have very strange experiences that other people have a hard time to relate to.
Yeah, yeah.
But if we say we have to absolutely remove this, then the person loses his or her identity.
Yeah,
you know,
yeah.
we have to accept that strangeness is part of life. But many people are still very afraid of that. They see someone with psychosis, they get very scared and they run away.
Yeah, yeah.
And
It's like somebody's, oh, my garden is clean, there are no weeds.
yes, yes, yes. And there is this example I've already used. Is people with for example, we've already had patients who in the summer it's very hot, and then they go out with shorts, but then a very thick jacket. Very, very thick jacket, and we could say, oh, that's not normal, that's not good. You have to remove your jacket, it's warm outside.
Yeah, yeah.
And if we do that, we don't understand the patient, because why is he doing that? Because he needs to feel the limit of his body, because he needs to sweat.
And then
So then he
feels,
feels,
yeah,
oh,
yeah,
there is the end of my body, and it creates a feeling of safety. Because otherwise he gets a feeling that, you know, his body expands
Yeah,
all over
No
the place,
boundaries.
no boundaries, and it's scary.
exactly.
It's scary. So instead of saying, you know, you have to take this out because everybody walks around in
yeah,
t-shirts,
yeah.
that's not, you know, we're trying to control. And in fact, that person knows that their method of dealing with their symptoms of healing is to wear that thick jacket, and it's a solution for that person. So we need to let it like that, and it's nice. It's part of the beauty, you know, of the diversity of
Not
of
all
people.
gardens are the same gardens.
Not all gardens are the same gardens, and you let a little wildness come out, and
yeah. When we think gardens, I was thinking also maybe if kids are in trouble, so kids are the gardens and parents are the gardeners. So both sides are stress. Parents are cleaning the garden, trimming, and kids are the garden, not having weeds. Yeah, both sides are stresses. And then how often do you work, like in Sowa Rigpa we talk a lot about diet and lifestyle.
yes,
So do you bring these two main elements into your treatment too?
yes, diet and lifestyle is a big topic. Sometimes I feel more like a nutritionist talking to a patient, or more like a lifestyle coach, because our patients, lots of them have issues with diet and lifestyle. First of all, you already have the medication that has side effects and that increases the appetite and the craving for sugar. So, you know, how, and then the other thing is they don't move. They're very sedentary, and then there is all the issues of obesity, cardiovascular problems, diabetes that come with it. So yes, diet and lifestyle are very important, but if you tell them follow this diet, you know, like eat salads or whatever, you have to eat healthy, it's not concrete. People don't do it. So it's about finding the ways to help them progressively on the long term, try to find a healthy balance, so that they have a healthy enough lifestyle and healthy enough diet. So sometimes we decide together, we know all the options, and then we decide, okay, let's start to suppress all the sodas. Just that, step one, and that I learned from you. So not about the sodas, but just to do step by step. It's
gradual
more
path.
a gradual path. It's easier to start with one thing because it's easier to do than to say no soda, no chocolate, no French fries. In Belgium we love French fries. No pizzas. No fast foods. If you say all those things, it's like so overwhelming. It's too much, and also to bring back the joy in eating, because lots of our patients, they eat because they must, but not because they enjoy it. So they eat very fast, this, and then after 5 minutes they have eaten like a lot, and then they don't feel really good, but at least they have filled their stomach, and then an hour later or 2 hours later they're hungry again.
In the Sowa Rigpa now, exactly as you said, sometimes the Sowa Rigpa doctors or TCM, natural Asian medicine doctors, we give them so many things. Oh, you don't do this, change your lifestyle and change your diet and so many things. But then I realized we give so many good suggestions and nobody does it.
Yes.
And then later I was trying to understand that part. It took lots of time. But then one day it made a click for me. That's also thanks to you when we are co-teaching these things. It's very difficult to change the diet and lifestyle.
Very difficult.
Because the root is in our mind.
Yes.
Right? It's like some pattern is repeating again and again. Of course, we are all addicted to some type of food, maybe carbs or sugar or wine, coffee, whatever. What I understood is we really need to help people mentally first, because what I'm really seeing is everything is like a relationship, what they call it, a relative truth. I try to understand relative truth in the medical way, and then for me it makes easy to understand about the relationship, our relationship to the food, our relationship with sleep, our relationship with exercise, our relationship with whatever we are addicted to it. So when I see more and more this, then I think this how we are addicted to unhealthy food, this is same like how we are addicted to unhealthy relationships, So our relationship in person, relationship with food, everything is kind of connected. And so that was kind of very interesting. So that's why now in my personal practice, I tell somebody, yes, you need to change the diet, but also you need some supports, Of course, one way is a gradual way and also skillful way, what they can change, what they cannot change, and increasing more their own awareness and make them to make a decision to changing their diets and so on. So that's also the case of the relationship. There's so many people in problems in the relationship.
For me, from what I learned from Sowa Rigpa, that I find so useful, is this idea that all our problems and symptoms arise from those 3 nyepas, Lungtripa Beken, which are mental conditions, right? Craving or clinging, the aversion, the anger, and the confusion. And I think those are mental states that we all have, and when those get expressed too much or not enough, then you start getting to have this all those issues, even physical illnesses arise from that. And to me, it's really helpful to have this idea that the mental and the physical are just not separate. They're just intertwined, and you can't separate both. Whereas in the classical medical way of looking at things, it's health and disease, and to make things easy, we just go out from the idea that the mind and the body are completely different nature. The body we can measure, the mind we can't. So we only focus on the body, and everything else, everything that's the mind, that's something esoteric that we don't know what to do with it. And so that's why still today there is a lot of stigma against psychiatry in general. You know, you have people with psychiatry diagnosis who go to the emergency room because they feel unwell. And they don't get examined properly by doctors because they immediately assume, oh, it's all in your mind, you know, and so there's no problem, go home. And then afterwards they have acute kidney failure or pancreas problems, and they were not checked up correctly because it was like, oh, you are a mental health patient, so you have weird symptoms.
Everything's in
so it's not looked. It's like the mind and the body are not connected, and many doctors still make that mistake to see it as completely separate. And I don't think they are bad people, those doctors. They're just unaware or ignorant that, you know, it's all, you know, it's not because we have a mental health issue that we don't have physical issues, and it's not because we have symptoms that it's all in our mind or all in our body, and sometimes also physical symptoms have the origin in the mind, and that's why I think Sowa Rigpa has a more balanced way of looking at
exactly. So
health and disease.
We call it the primary cause is the ignorance or confusion, then desire, attachment, then anger, aversion, and then those are original our like mind and nature. They're connected to diet, lifestyle, and then we make all wrong choices and wrong relationships. Everything starts from there. And then it's like everything we call dang. It's like accumulation. Once over accumulated, then something manifests, which is called the imbalance. And then we try to find the solutions to that, to rebalance. We have learned from you about attachment theory. I like that very much, because also in the Buddhist tradition it says, like Buddha's one of his point, it says all sufferings, you know, pain and sufferings, original cause is self-attachment. And then
he says self-attachment, or he says attachment?
Attachment. But then in this attachment there is a kind of self-attachment, like our own relationship with ourselves, you know. I see this Buddhist theory about original cause of pain and suffering, and this attachment theory. Maybe it's not exactly the same, but I really like this attachment theory. It explains so many things. And you know, it's like originally we were confused, you know, so many things. Can you tell us a little bit more about attachment theory?
Yes, and attachment theory, the word theory in science is not the same as a hypothesis. When we use the word theory, we actually mean there is enough scientific evidence to support this idea. So first it's a hypothesis, we don't really know, we still need research to confirm or not confirm the hypothesis. And we throw the hypothesis away if we find that it's not true. But if we have enough evidence from lots of studies, then it's called a theory. And so the attachment theory was so the idea of the attachment theory was developed by John Bowlby in after the Second World War. And it's really about, we've always been saying that human beings, we want to eat and to reproduce and not die. That those are the three things we want to do that are important. But in fact, we need the attachment, the healthy attachment. There have been enough, so small children, they need parenting, whether from their parent or from primary caregivers, whoever it is. Doesn't necessarily have to be the biological parents, but they need people to take care of, because if that doesn't happen, the child will not eat anymore, or will not develop properly, will not have a healthy, balanced life. So we need this secure attachment, and so secure attachment is really this idea where you feel the safety and security from an elderly person who has more experience and who is there to protect you and to be there for you, to look after you, whatever happens, and so you are protected against danger, because in the wild nature, a small baby without a parent is going to be eaten by predators very quickly. So it's important to have this
kind of protection also from wild animals.
From wild animals,
like dogs and cats, they protect their
They can
babies.
also, even if they wouldn't be eaten by dogs or cats, they would not know how to eat, and they would die of hunger. So that's why with human beings is it so important to have, we are social animals, we need to take care of each other, and so those with more experience are there to look after the younger ones, and so we always say in attachment theory you start with attachment to your primary caregiver. Let's say, make it easy and say it's your parent, and that parent is there to nurture you, to nourish you, but to protect you from danger too. And so if you know that from the parent, then you feel safe. And a child that feels safe, he will start to explore and start to discover the world, and then gradually go further and further away from the parent, and always come back, go further and further away, and then go explore, meet new people, and feel the safety of meeting new people.
Little birds, they fly away, hunt, and then come back.
Exactly.
And the secure attachment also based on like self-trust,
Yes.
They kind of downloaded from the parents.
Yes.
Protection and safety, security, and then they become like that.
Yes.
So it's like building a very healthy relationship toward ourselves.
Exactly.
I think that part is close to Buddhist.
Yes, I think so. I really think so. I really think it's, you first need someone else, and I think Buddhist teachings say the same. You first need an external teacher.
Exactly. Yeah.
You build a healthy attachment to that teacher, good connection. And it means that you feel safe and secure, but the parents will also provide for the needs of the child. So if the child needs to eat, the parent knows it and will provide for the food. If the child needs security, the parent will protect it from the dangers. For example, by saying you don't go run next to the river, because that river is dangerous, you cannot swim. And the parent will look after the child for not going into the river and fall in it. But of course, when the child grows up, the river is not a danger anymore. So the parent knows that that's not a need of the child anymore to be protected from the river, but maybe the child needs other protections. And so it changes with time also what the needs are.
Our relationships are changing, no?
Yes. Yes, until we become as adults completely autonomous. And the parents don't need to look after us anymore because we know how to look after ourselves. We know how to build healthy relationship with others because we feel this security inside.
So I think it's interesting, as you are saying, theory is a proven, like, studies and scientific studies and so on.
Yes.
The way you are talking this healthy attachment.
Yes.
And even if we just observe carefully about the birds, they are doing the same thing,
They're doing the same in the nature, the same things happening.
Dogs and cats, they are doing same thing. And then I remember also my childhood being a nomad, growing up in the nomadic land, and animals, I see that even the yaks, they become so protective. And then of course the animals, they grow up fast, and like the parent, also in the animal world, the children and the parents, they are building a kind of very healthy relationship.
Yes.
And once they are ready, and then they are ready their own ways.
Yes.
Yes,
and
then very organic.
And they will feel the security, and then be able to explore solutions and be creative. Because when the stress is too high, when you feel insecure, then you don't dare to explore other possibilities. Then you just repeat the same strategies all the time, even though they might not be the best strategies. That's the one you know, and you are too afraid to try out other strategies.
And then the problem is when we develop this insecure attachment.
Yes, then when we have insecure attachment, we don't have this basic sense of safety. We feel the world is not safe.
Exactly.
And so we don't feel safe. And that gives rise to more mental health issues like anxiety, paranoia, depression, because who is looking after me? Who cares about me? And even though people don't realize this because they've always been in that state. They have, if you talk to them and say, you know, do you feel a safe base inside of you? They will immediately know the answer. They will say, no, I don't feel safe at all. I have no idea what it is to feel safe.
Exactly. So that shows like there's originally not trusting in ourselves.
Yes.
And we're not being like good enough or not safe or healthy enough, and then there's always something wrong. So that's actually becoming original, our own connection or relationship, right?
Yes.
So I think when Buddha talks about this, the attachment, now I don't say attachment theory.
No.
Buddha said the cause of the suffering and the pain is this self-attachment. So actually, Damme or Rangla Chak, Dechak, really like attached, and these are in a kind of unhealthy way. I see there's maybe we need to go a little bit more detailed what really Buddha meant, but I think there's a very strong connection.
I must admit, when I read in the beginning those Buddhist teachings, I was very confused with the word attachment, because for me attachment is not a bad thing, it's a good thing. And so I read attachment is a problem. I was like, no, it's not a problem, it's actually good. I think it's the way we're trying to use it. So the attachment theory is really also about this feeling of safety and security that we need as a basis. And I think in the Buddhist teaching, what's meant is more the clinging and grasping to an identity, to an image of ourselves.
It's a wrong self.
Yes.
Unsafe self.
Unsafe
exactly.
self. Because we don't feel safe, we create this whole image about ourselves.
Then we are living
that
in
we're
fear.
trying, that we try to protect at all costs. And that makes us very nervous if that image is threatened. And then I think that's, personally, I think that's what Buddhist teachings mean when they talk about this attachment. And so I would more say clinging, craving, trying to grasp something that you can't control, to grasp an identity that you created to protect yourself.
So that's why I think in the both Tibetan medicine way, there's like a healthy attachment, unhealthy attachment. I try to understand in Buddhism, unhealthy attachment is like a kind of bad relationship with ourselves, and that's becoming cause of many issues. And then the healthy one, I was thinking more maybe like a bodhicitta, Bodhicitta is the love and compassion and understanding. And when we say bodhicitta, there is the element of self-trust and security.
Yes,
so that's why I think, we need to work a little bit with terminology. So I think in the Buddhist teaching, if we see there's a healthy attachment and unhealthy attachment, I think it helps also for Buddhist people to understand it better. Otherwise, there's like ego attack. Like we should be selflessness, this Buddhist philosophy. Many people try to attack on the self, and then like ego is the problem. And then, if you don't know what is your ego, like how you can eliminate that ego, right? So I think there's some kind of like a basic misunderstanding.
And I really think that this ego in the beginning has a function to protect us, because we are fearful, we are afraid of certain things. So to attack it directly can make us collapse completely. It's dangerous. So I would say more to understand that we have an ego, that this ego has a function, that this ego is playing a role, that we are just playing a role, but it's not really who we are. And to see gradually start to see the illusory nature of that ego, but that ego is still there. It's not that we have to destroy it. It has a function, it has a role.
So that's why Tantric Buddhism, it comes like this Ngompe Ngajel or Thai Ngajel is more like positive and divine, this ego. So there's a positive aspect, and it's very important we have that one. So for me, it was very important that we launched this together, the Sowa Rigpa Counselor and Healing. And I tried to bring the Buddhist teachings and then the Sowa Rigpa practice. We tried to understand, and then it was really amazing. You bring this modern psychology study, and we try to bridge it together. Actually, in a way, there are so many common sense and common understandings, right?
Yes. Yes.
So that's actually originally I was saying when people say, okay, Dr. Caroline is a psychiatrist, and then so we are talking Sowa Rigpa is maybe a little bit closer, but Buddhism is even distance, you know. So that's the imagination, but I think the more we teach together, the more we understand, the more we have dialogues, and the more we see the commonalities and so
Yes.
much connections. And I think probably this is something we really need to focus more and bring up, you know, to help people.
Yes.
What do you think about this?
Yes, I agree completely, and I am very grateful that you have wanted to create this dialogue, because indeed I think it's very important, because how I grew up, and I think many people like me grew up, was very, you know, Western style, organized, the English-French garden style, you know,
Exactly.
where it was all separate things. Like also the school system is very separate. You're good at math but not good at literature, you're good at this, so it's all those parts, and we don't really, I didn't realize this at that time. It's not that it's a problem or something, but didn't feel whole, didn't feel like entirely me. And so I had my parts that were interested in Buddhism, I had my parts that were interested in science, and I had parts that was a university student and who wanted to become a doctor, and I didn't make connections between all those parts. And I think that's what people say, they feel disconnection. It's sort of how I felt too. There was the student me, the hobby me, the playing music me, you know, all those different
Studying medicine
me, and
you're interested in Buddhism also early age?
When I was a teenager.
Oh wow.
Yes, when I was a teenager I was fascinated, but the thing is I had nearly no information. It was before internet arrived in Belgium. The internet came later. In my teenage years there was no internet. I had no idea what it was, so there was just a local library and there was just one book on world religions, so Buddhism was part of it, so that was kind of the information I got. And then I had some posters from Tibet, and I was very fascinated, that I hang in my room. I don't know how I got those, but anyways, yes, I was very interested because it seemed so logical. I like to understand things first, and if they don't make sense, then I disregard. That's a little bit how I am. And so before I go into something, I really need to understand what everything is like. And so maybe that's what was the problem with Christian religion, because I grew up in a Christian environment, Catholic school, you know, we have religion class, and then you ask questions in religion class, like, why is this? And then the answer is because. And that's it, and just be happy because that's the truth. And why is that the truth? Because that's how it is. And I was very dissatisfied with those explanations that didn't make sense. Like, it's the mystery of Christ. And I'm like, yeah, I want to know what the mystery of Christ is about, you know? So it's not that I'm against Christianity at all, or against Catholic. I didn't get traumatized by Catholic religion, but
you didn't get answers.
But I didn't get the answer. I was not satisfied with the answers.
And then the Buddhist philosophy is causality, no?
Yes.
There's always causes.
There's always a cause, and that made sense much more. Even though Buddhism talks about reincarnation, which Christianity does not, they have a logical explanation, whereas Christians don't have a logical explanation for why we are created from nothing and what's before the nothing, you know. And so that's why I was drawn to Buddhist philosophy, but I had to read myself into it because it's not my culture. I didn't know anyone Buddhist at that time. I just had that one book from the library, and then later on I started reading other books, and you know, and it really had to, you know, enter my mind, and you know, trying to understand the logic, and so yes, and that's also, again, to talk about Buddhism and Sowa Rigpa. It's really, we look at the human being in its entirety, in wholeness, in a holistic way, and in connection with other human beings. That it's not separate. This idea of interdependence, yes, that is really something so important, I think, because it's, for me, it makes so much sense, much more than the independent human being who has to solve everything by himself. Well, we need others. We can't function without others. A baby without parents, with no one to take care of the baby, just dies. So it starts, we always are connected to each other, and I think for me that makes so much sense. So that's how I got, you know, interested in all that. And when I met you, and one of the first things you said was Dharma is the perfect psychotherapy. For me it was like, oh my God, really? So all those separate parts that I had in my mind suddenly fell together and made a logical whole. And that felt so, how do you say, freeing. Like, oh, so, you know, there are not all those separate parts of myself. The fact that I'm a medical doctor is absolutely not different than being interested in Buddhism, and of course these Buddhist ideas influence me in my work, and what I do in my work help me understand Buddhist teachings.
All interconnected.
Yes, everything is interconnected, and so in me too everything is interconnected, and that was so freeing. So yeah.
And especially this interdependent and interconnection, it works very well in family therapy.
Yes,
right?
As a psychiatrist I could choose to do psychotherapy or not. I wanted to do psychotherapy because I wanted more than just knowing about medication. To know what to say to patients, you know, when they talk about their suffering. I'm not going to say, oh, here's a pill, you know. If someone talks about their suicide thoughts, how am I going to answer to them? And so we kind of have a choice in which sort of psychotherapy you can do, and the idea is just do what fits most with your personality. It's not that one is better than the other, but we have different personalities, and it's good that you have different psychotherapy trainings. And so I was drawn to the family therapy one because of this idea of interconnection. So the basic idea is that humans are not separate from their environment, from their family first, from their network, from work. And so that we see in family therapy, we always look at the relationship between the person and their environment, and how that influences who that person is, and how that person influences their environment. So it's in both ways. And so, and then of course, yes, probably that's why I was drawn by both family therapy and Buddhist teachings and Sowa Rigpa, because it really focuses on the relations and the connections between people and nature. But it's always about relationships and connections and interdependence, and
that's important because we are social animals.
Because we're social animals. Yes.
Yeah, my personally, when people they ask me what do I think with you know, modern drugs, you know, taking medications, this I always say I don't against modern medications, because in many cases we need them because they save our lives. You know?
Yes.
So the same way also we need there are specific drugs for the, you know, the mental issues and so on. I support that. And then some people they think those things are only resolved by medicine, you know, drugs. I think that's also like maybe not understanding or misunderstanding about these things. So now I have a question for you. In your practice, as you mentioned, you're working in 2 psychiatric hospitals. So in your way of dealing, like how many percentages of your patients they use drugs?
Most of my patients, nearly all my patients take medication. Because for psychosis, up till now, we have not found a better way to treat. So for other conditions in psychiatry, you don't necessarily need as much medication as in psychosis. So psychosis and schizophrenia, whenever my patients get off drugs, and now there is this whole movement, but it's because we have to taper it down and not stop it immediately. I have tapered down a lot of medication with my patients very slowly. They relapse. I have not had one patient yet who has not relapsed. I talk about those who have really the diagnosis of schizophrenia, because bipolar disorder is a little different. In bipolar disorder, I would say most of them need medication, but if they can really learn to know themselves and to be open about the fact that they are bipolar, then sometimes it's possible to do without medication for bipolar people. But it really asks to be very open and accept yourself and your flaws.
And also they take responsibility.
And take responsibility,
themselves.
because for bipolar disorder, one of the first triggers to manic episode is lack of sleep. So those people, I always tell them, learn to recognize this. If you you sleep less and you have more energy, then it's a sign that a mania is coming. And then I agree, if they really know themselves, I agree to give them sleeping pills for a while to cut the manic episode before it arises fully. And there I have been successful with several patients who, whenever they feel that they have less sleep, they take a break from work, they come to see me, I give sleeping pills. You know that I don't really like sleeping pills, but in that case I do prescribe them for 2-3 weeks, maximum 4 weeks. I give them a break from work, and that's enough to recover and to get back to normal and to not have a manic episode. But if that's not the case, then it can be very bad, because people really can go up like this and then very depressed afterwards and have really psychotic depressions too. And so I have certain patients, I'm not saying most of them do take medication too, but some of them can do without, but really have to learn to know themselves.
That's the case of psychosis.
Yes, so in a manic episode, the definition of mania is that there is psychosis in it. So it becomes so high that you disconnect from the reality. You feel so good that you become a Buddha and you can fly.
Exactly.
And then you can fly and you defenestrate because you can fly, and then accidents happen.
Sometimes this can triggers from the retreats, spiritual retreats.
Yes.
They're saying, I felt the energy and this and that, and they forgot to sleep.
And they forgot to sleep.
Exactly.
Yes. And that's a very dangerous thing.
What do you think about antidepressants?
So antidepressant is a different story. We know from scientific studies it's overprescribed, especially by GPs. I'm not blaming GPs, but GPs don't have time, and it's an easy solution. So people come and they say, I don't feel well, I feel a little depressed, I have burnout, and GPs give antidepressants. But from scientific research, we know that antidepressants work as well as placebo. So in 30% of the cases.
30%.
30%. For mild and moderate depression. And for severe depression, you have to take antidepressants because placebo effect doesn't work anymore. So it's also 30%, but placebo will not work. So to me, people with mild and moderate depression, if they have good psychotherapy or good support from a psychologist, they don't need medication. Because medication will give the side effects. But if you have, because placebo for me means to have, it's self-healing.
Exactly.
And the self-healing will come when you have a trustful relation. You trust your therapist, and then you think it all comes from him, but actually it comes from you. It's your mind who's actually healing. And so for depression, we could really reduce antidepressants, but sometimes it's needed in the cases of severe depression. And then it's only 30%, and then it might mean that with severe depression, the antidepressant is not working well enough, then we need to switch to another one, try other ones. So there are different ones you can try, and sometimes even try ECT, electroconvulsive therapy, which is like miraculous therapy for severe depression. So the person is put asleep and we put electrodes, so people are very scared of this idea. But I
think they are scared because of the old style.
Yes.
But
today,
old style is similar like electric shock.
It's an electric shock, but old style was without anesthesia and without muscle relaxants, so they were like convulsing. Whereas today we give general anesthesia and we give anticonvulsants, so the body is paralyzed during the session. It doesn't last long, it lasts maximum 2 minutes. Then we induce an epileptic activity in the brain, so you really see the brain waves go like this. And then the person wakes up, is back to normal, so it's 2 minutes that you're sleeping.
It's like a reset.
It's like a reset. We don't know why it works, but it's amazing, it really does work.
And who discovered this?
I don't know, some crazy psychiatrist.
Yes, exactly. Started doing electric shock.
So try to do, in the past they have done so crazy therapies.
So this one works also the case of severe depression.
It works the best. The more severe the depression, the better it works.
So people needed a reset.
Yes, it's a sort of reset, and you need several sessions to consolidate the effect.
So in this case, your suggestion for the depression is it's better patient seek professional help instead of just go to GPs and take the pills.
Yes, go to a psychologist or someone you trust, a homeopath, someone you really believe that that person is very professional and is really good at what they're doing and that you really trust. And then it will really work well.
Homeopath or Sowa Rigpa Doctor.
Oh, Sowa Rigpa Doctor, of course, of course. Yes, why didn't I think of that? But of course, yes. And so then the patient will be trusting in that person who listens and takes the time to find the appropriate way of helping to treat the person with minimal side effects. And there is always this saying about depression, after the rain comes the sunshine. Even if the rain lasts a long time, Belgian rain, there is always sunshine coming afterwards. It sounds really very silly, but it's a really deep truth that it's not forever. And that's what I say a lot to my depressed patients, is to say, okay, right now, and they don't see, because they don't see the end of the tunnel, they are really stuck in their depression and really in the desperation. And then it's really like to say, okay, you don't see it now, but I know you will get better. I just don't know when. And then.
So if we divide the depression, there's a mild depression, moderate depression, and severe depression.
Yes.
Like the percentage can be like 30% of each, or?
I don't know. Of course, I see mostly the severe depression.
The severe.
Because I'm a psychiatrist, so I see the severe cases, but mild and moderate cases, they go more to GP or psychologist, and so I have a hard time evaluating the numbers. I think most people suffer from mild and moderate depression or
that's
burnout.
Why we need that's why we need the more Sowa Rigpa counselors.
Yes, we need more Sowa Rigpa counselors, especially for burnout. I really believe Sowa Rigpa can help much more for burnout than antidepressants. I don't really believe in antidepressive medication for burnout. I see more side effects, and I think burnout is such a complex thing that is happening. You know, you're overwhelmed, overworked, and all your energy is gone. And I think Sowa Rigpa has many more methods which can be helpful for people with burnout.
So in your practice, what is the definition of a burnout?
Well, burnout is not considered a mental
I
disorder.
Know.
So
but
in my
that's
practice, I know
why many people, they don't pay attention much, right?
Yes. And so most of people with burnout, they end up at their GPs. And they are not so much with psychiatrists, although there are psychiatrists who specialize in burnout, but then they usually work also with other therapists and they collaborate together to help the person with burnout, so they also understand that we need more than just talk therapy for burnout. So it's but it doesn't necessarily has to be with a psychiatrist. So for me, because I focus on severe mental illness, when people with burnout come to me, I tell them to go look for someone else. So then I can really focus on severe mental illness. But I really truly believe that, well, I know that approaches like Sowa Rigpa, mind-body approaches, which, you know, which help the patient really reconnect to their body. Take the time to do more things more slowly, to do nothing anymore, to take care of oneself with horme, invest in healthy food, you know, all those things. I think have a big potential to recharge. It's actually about recharging the battery. And
exactly. You mentioned about the long Rigpa Counselor, so we have the depletion of long sepa, and then depletion of Rigpa, depletion of Pekken, and then we need to rebalance that.
Yes.
Normally in the Sowa Rigpa, everybody think is excess, you know, excess. So there is an excess and there is a deficient.
Yes.
That's the depletion.
Yes.
Actually, once I talked with some Sowa Rigpa doctors. Everybody was talking this excess and disorder. I just mentioned we need to focus more on the deficient too.
Yes.
So many people are overworked and mentally, physically, energy is depleted.
Yes.
I thought yesterday you were saying something, depression even including like when you do something, work, the fascination, you know, you enjoy you are doing something. Some people, they do a lot, they look very productive, but there's no enjoyment, there's no meaning. No?
Yes.
And there's no like a passion or quality there anymore.
Yes, because people very often believe that depression is extreme sadness. It's not. It's not being able to even feel the sadness. You feel disconnected from your emotions. And that is very scary. People don't feel the joy, but they don't feel the sadness. They say, I wish I could cry. I can't cry. I can't feel sadness. And that is terrifying because you feel no emotions and then you feel like non-human anymore, because that's the definition of human beings, is we have emotions. And so being depressed is very distressing, and people with depression would rather be very sad or very angry, because at least you feel something.
Then there's sadness and this and that.
And there they say, I feel empty inside, I feel nothing. And I used to feel things, and now I don't remember how that feels. And so for many people with depression, it really feels like hell. And they really are in hell. They don't see any hope. It's all black around them, and if you ask them to give a color, it's black, no color. No feeling, no ups and downs, no nothing. It's like feeling connected from the movement of life.
Actually, this feeling I understood during COVID, because before COVID, our noses can smell everything. This is good smell, bad smell, this and that. And during COVID, the smell goes away. And then you see something and you know they have a smell. You don't smell at all, right?
Yes.
I thought maybe this is something. Some patient, they say they don't feel anything. They don't know who they are, like a kind of empty hole. I thought, oh, maybe this similar feeling, you know, right? We know we have a nose, we know these things have a smell, but we're, like you said, disconnected. We don't know this.
Yes. And that's why the solution often is, the only solution that they see is suicide. Because there is this hope, this last hope, that by killing themselves they'll stop feeling that disconnection, and that it will disappear, that suffering of being in hell will disappear. And so so that's why I think, you know, and many people want to do good and tell them, oh, you just have to take yourself back together and just enjoy life. You have everything. See, you have a family, you have a good job, you have a house. There's no reason to be depressed. They don't feel understood when you talk like that.
Exactly.
It's better to go with them in their journey on why are you feeling like this? How does it feel? And then they are like, oh, there's someone who's listening to me, and someone who's understanding me, and then that means there is connection with someone who journeys with them in the hell realm, you know, and then that's the first step to give more hope, because someone connects to them.
Understood.
Because there's so many suicides, it's so terrifying. I think it's really, we really have to, you know, we should all be educated on how to talk to someone we know who is so distressed that they're thinking about suicide. and also dare to talk about it, because people also are afraid to talk about it, because then they think, oh, I'll induce the idea if I talk about, you know, if I ask about suicide to my partner, then my partner will commit suicide. It's not. It's by not talking about it that they feel so disconnected that they will do it. By talking about it, they feel more understood, and the chances of doing it will go down.
I think in this case also the education with friends and family members are important too. No?
Yes.
And normally there's some people are very depressed, and then the family members are not understanding that. Like you said, you know, why you are depressed? You have everything. You have place to live. You have work. You have money. Like this, they really feel like they are disconnected, and then they are externally disconnected with the relationship. People.
Yes.
That's even more.
And so they are judging.
Exactly.
And when you are judging, it's because you're ignorant. You don't know what you're talking about. And it's really by really, really listening that you'll be able to connect to that person, and that brings the healing. And so whenever we are judging, we are wrong, because we don't know what we are talking about. And so it's really about also daring to go dive with that person into their darkness, and be with them, and to be present with them, and to hold them, and to say, okay, I'm with you. I hear that it's so hard for you that you're thinking about suicide. That
is called the compassion, no?
Yes.
Suffering with. Compassion means suffering with. Real compassion is able to listen and to be with somebody instead of externally judging. But then, if we have too much compassion, then maybe this person, too much compassion, being somebody overdoing, get a burnout too. So we have to find the balance in many ways.
I think for that, I read one of Matthew Ricardo's book where he talks about the difference between empathy and compassion, and that is so interesting. He says empathy burns us out, compassion gives us energy. And he gives the example that he participated in a study with in Zurich, I think. And he because people were asking him, we don't get the difference, we don't understand the difference. And so the idea was that he was going to meditate on empathy first, and then go in a brain scan, and then the next day meditate on compassion and go in the brain scan again. And so what he did is he meditated on empathy, and he was so exhausted after that he said, I can't wait till tomorrow, I want to go in the scan again immediately and meditate on compassion. I can't wait till tomorrow. And then they asked, what's the difference? Because when he meditated on compassion, he was full of energy afterwards, he was all refreshed. And so what he did is that he imagined, he visualized, so when he was doing the empathy, those children who were found after in Romania, the fall of Ceausescu, those children in orphanages who were like, you saw those very distressing images of those children in cage beds, banging their heads on the wall, having had no human love, and they were like in super distress, and it really shocked the world. And so Mathieu Ricard took that image, and with empathy he just tried to feel what it was to suffer like that. And he got so drained out that he felt completely, he was tired, he had no energy anymore, and he couldn't wait till the next day. So when he did the meditation on compassion, he did the same exercise. He imagined, he visualized those children, he felt their suffering and everything, but he visualized himself as being full of light, and going to these children and holding them in his arm. And by holding them in his arms, he would give all his light to those children, and those children would become happy. And by doing that, everybody ends up being happy, and so he felt full of energy, and he had felt the suffering, but he had given all his light to those children in his visualization, and so that's what gave him energy. And so that's what the researchers concluded after that experiment, is that we focus in the medical world too much on empathy, and that brings a lot of burnout in doctors and nurses and healthcare workers, and that if we focus more on this compassion, even if we don't do anything, we can't solve the problem of those children of Ceausescu, but just visualizing that we're sending them our love, and that love is healing, then it gives us energy to continue. And that's a protection against the burnout. So I thought that was a very interesting research that I try to, for myself, to apply in my work.
I think,
you know?
yes, that, yeah.
And that Matthieu Ricard says he really had from his Buddhist practice and his Buddhist teachings, that for him there really is a difference between empathy and compassion.
And then compassion in this case is more with wisdom.
Yes.
You know, wisdom, knowing your physical limit and boundaries.
Yes.
So thank you, Dr. Caroline.
Thank you, Dr.
For
Nida.
me, it's a great pleasure for co-teaching the Sowa Rigpa Counseling. So I know we have like 50% of modern psychological studies from you. All the information is very precise and very also communicate very direct, and I also find it very simple, you know. And as you are saying, when you are young, you are interested in Buddhism. When I was studying Sowa Rigpa, I always liked the idea of modern psychology, but not so easy to meet doctors or teachers to can give you very simple, essential way, understandable. So I found that from you, and that's why I'm also very happy that we are doing this class. And I can see from our students already, you know, benefiting, transforming their lives, and you know, enhancing their profession and helping others. And I'm very, very happy to do this Sowa Rigpa counseling class. And yeah, I want to thank you for accepting my invitation and also being my teacher and co-teaching the things. And I'm very thankful. And hopefully many people will join with us and study more.
Yeah, I want to thank you too, the same way, because I was always very interested in Buddhism, and you are a very open-minded person who is interested in Western psychology and who doesn't cling to only your own. Of course, you have a very, you know, you have a very strong background in Buddhism and Sowa Rigpa. But from there, from your strong background, you have this open mind to come and communicate with other ways of thinking, and I really appreciate that, and I'm very honored to be able to have this dialogue with you, because I think that's the future, to have all those different ways of looking at things and dialoguing together and bridging things instead of separating things.
Exactly.
And I think it's so powerful to have the best of both worlds, and see that we're actually communicating, saying the same things but with different words.
Exactly.
And that people can really learn to use all those different tools and adapt them to the people they're going to counsel. With certain people will be more open to more Sowa Rigpa approaches, others to more, you know, more psychological modern approaches, and it's actually basically the same principles. We're all humans.
Exactly.
And
organic
so,
humans.
Organic humans, the diverse humans, and I think to do this we really are able to be able to help such a diverse range of people, and that's the future. I really think that's a melting pot of cultures, of different traditions, where we all communicate to each other, but and I think in your case you are very strongly rooted in a tradition with a lineage, and that's very important, I think, because you know it has been thought about for centuries, and it doesn't come from nowhere. It's not just the truth that came out from the sky. I'm not interested in truths that come out from the sky spontaneously, just like that. And so yes, I think this course is very useful. I can see it too. The students are very, well, at least the ones that I talk to are very happy and
also very productive, right?
Very,
in their
yes,
work.
yes. It's I think everybody feels that this synergy of having all those backgrounds that are communicating and dialoguing, I think it's freeing for everybody. And I want to thank you so much for having created this course.
I'm very happy. For me, you are a book, my open book. I have questions, I learn from you, and then put in the practice and see so many things. And also in the past, I always say, oh, why the Tibetan things are better than the modern ones. I used to try to find what makes us different.
Yes.
But now I'm exactly opposite. What things make us same and come together as a human.
Yes.
And I think that's very important. That's why I have this idea of organic. At
Yes.
end of the day, we are all organic humans. We have different culture, different languages, and this, but we have same emotions.
Yes.
And we try to find balance with that.
Yes. Yes. Yes.
Mm-hmm. Yeah.
Yes.
Thank you.
Thank you.
And I really wish many people join us for the class. Sowa Rigpa Counseling, Sowa Rigpa Institute.org.